Now coming to this MCQ, the MCQ asks, Ottawa rules assist in determining the need for radiograph in injuries of which joint? So you usually don't have any clue regarding this MCQ. So we'll understand what Ottawa rules are for. See, the Ottawa rules are basically for assessing whether the patient needs a diagnostic imaging for ankle or foot injuries. Because not all patients who walk into your emergency department with an injury around the foot or ankle require an X-ray. Okay? Because usually they have ankle sprains. Now, by deciding which population requires an X-ray or not, you're doing two things. One is you're avoiding the exposure of radiation to that patient unnecessarily. Number two, you're conserving your resources. So this is where your Ottawa rules come in to guide you whether the patient is really in need of an X-ray to help you diagnose his condition better or not. So what are the things that clinically assess in a patient that makes you think whether he warrants an X-ray or not? The first thing is you look at the lateral malleolus and the medial malleolus. If there is a patient who complains of pain, particularly on the posterior edge or tip of the lateral malleolus, or complains of pain at the posterior edge or tip of the medial malleolus, or if he's unable to bear weight and walk at least for 4 steps. So what are the 3 things you need to see? Medial malleolar pain, or lateral malleolar pain, or inability to walk. If you cannot do any one of these 3 things, then what do? You get the ankle X-rays. You get the ankle X-rays to confirm if he has a problem in the ankle. On the other hand, if he complains of pain at the base of the 5th metatarsal, or if he complains of pain at the navicular bone, or if he is unable to walk because of the pain, then you can go for foot X-rays. So, base of 5th metatarsal, pain over the navicular bone, or unable to walk. If the patient has any one of these 3, then you can get foot X-rays. If the patient does not have any of these problems, then there is no need to get a foot X-ray or an ankle X-ray. Alright? This helps us decide whether the patient really needs an X-ray of the foot or an ankle. And these are what is known as your Ottawa ankle rules. So what do you think is the correct answer? The correct answer here is ankle.